Now we go to our special guest, Marconi Cooper. In these 3 days, and even before that, we have learned to know him and really appreciate his spirit and his attitude. And we are here now to hear the entire story of how the cell phone was invented. Marty, the floor is yours.
Giovanni, I take it I'm the last speaker?
Yes, you are.
And how much time do I have?
All the time that you want.
Wow, what an opportunity. I always appreciate being the last speaker, as a matter of fact, because I have the opportunity.
Would you like to move around,
Oh, okay, that's good. On. I may have turned it off. Are we on? Yeah. Being the last speaker, I have the opportunity to explain to you what everybody else meant to say. So the first person I want to take to task is Vint, who's well, Vint, your remarks were really profound, and I appreciate them. But on behalf of those in the audience that may have whiter hair, I'd like you to know that passion and creativity are not only the purview of the young. And as evidence to that, I did have an idea recently. Am I still talking? Yes. Which I presented in a speech to the Federal Communications Commission, the U.S. Federal Communication Commission. I was invited by the chairwoman, and I introduced a new idea, which I will not tell you about now. But the press reported on that, and the statement was that Marty Cooper has introduced a wacky idea. I don't know how you translate that into Italian. But maybe you should listen to it because he has done some useful things in the past. So there is the possibility for people with white hair to come up with something new. And perhaps it's not a wacky idea. And those of you that are interested, martin.cooper.com, and tell me what you think of the idea. I want to talk a bit about how Marconi inspired me, because Marconi had some huge obstacles. He had some advantages. He did have the opportunity to operate in spectrum that was basically interference-free because there was nobody else transmitting. And so when I started examining the issue of how much spectrum do we need today, I looked at what Marconi did 100 years ago and started to do some extrapolation. And I discovered that the ability to put information through radio waves has doubled every 2.5 years for the past 110 years. Anybody that knows how to do the mathematics know that comes out to 10 trillion times improvement. There's no reason to believe that that can't continue for the indefinite future, and that turns out to be a lucky thing, because as John pointed out, we need that capacity. There have been a number of projections of what kind of capacity that we are going to need in the future. They all come out to, in the next 5 years, we are going to need something like 20 to 40 times increase in total capacity. So yes, we are going to need Wi-Fi because that's going to essentially double the capacity, but we're still going to run out of capacity if we don't increase the capacity of Wi-Fi and of our other networks. And just to give you an example, just sending your EKG, a picture of what your heart is doing, which is going to be an important part of the healthcare revolution, will take about as much capacity on the system as all the other communications that you are doing today, all the voice and data communications. And that's just one application. So we are going to need a ton of increased capacity. But there's another observation that also John pointed out, is can we afford to do all these things? And so I did another extrapolation. I looked at what Marconi charged for transmitting information through the network. And I discovered a really interesting fact that some politician in the early 19th century decided to send a message to the French consulate. This is an American politician, and he was going to be creative, and he sent it by radio, transatlantic. And he was a wordy guy, and sometime shortly thereafter, the bill came back. And the bill was bigger than the salary of the President of the United States at that time, so you had a person in trouble. And I did an extrapolation of what it cost to send a bit of information through the radio network in Marconi's time coming up to now. And interestingly enough, it has halved every 3.5 years. So instead of a 10 trillion times increase in data speed, we now have a 1 trillion times decrease in cost. And we are going to need that if, in fact, we are going to do the kinds of things that I talked about in my earlier talk. By the way, is there anybody here that didn't hear that? I know, Francesco, you didn't. Anybody else that didn't hear the first? You didn't. Well, I'll give you a private session. I just want you to know, I thought there were going to be more people, so I stayed up late last night trying to do a 1 minute recap of what I said, and I actually succeeded, but I'm not going to do it for you now. But what I want to do now is part 2 of my original speech. If you recall, I talked to you about the 3 revolutions that we're going to have in education, healthcare, and social networking. And I only talked about healthcare very briefly. I want to spend a little bit more time telling you about what I think is going to happen, actually making some predictions about what is going to happen and when it's going to happen. Where are we today with wireless healthcare? There are actually some things happening. Interestingly enough, the most interesting things that are happening are in third world countries. So in Mexico today, there are doctors who are examining the eyes of people in villages using an ordinary smart cell phone and a little device that clips onto the camera of the cell phone. And so a person could look at this device through the cell phone camera, transmit the information, and the doctor can analyze the person's eyes and treat eye diseases. That's actually happening today. And this little optical device, it costs, at least in quantity, the order of $5. Cost is not an issue. There's another experiment also going on in Mexico where a device, a fetal measurement device that works ultrasonically can be applied to a pregnant woman, and a doctor can do an analysis, once again, remotely. So a woman in a small village in Mexico can be treated by a doctor in the big city at much, much lower cost and solving a really serious problem. Even in the developed countries, there are some things happening. There are services, as an example, that apply to compliance. One of the big problems with medicine today is the doctor prescribes something to somebody and says, take these pills and take one a day for a month. And of course, the patient takes the pills, and after a few days feels much better. They don't take the rest of the prescription, and 3 weeks later they're back in the hospital, and you know who pays for that hospital visit. All of us do. How do you solve that? Well, one way is keep reminding people to take their pills. Is that 100% possible? Maybe not. but it does encourage people to do that. In the future, the pills themselves are going to report whether they've been taken. And that technology actually exists today. There are pills now that have a super miniature transmitter in them that doesn't get activated until the pill gets into your stomach and your acid dissolves the pill, and the doctor knows that you have taken your pill. There are today systems that allow people to, if they have a medical problem, to call a nurse. And it's a very nominal cost, and the nurse can give them some advice. Not going to treat their medical problems, but help them in some useful kind of way. That kind of a service exists today. So we're starting to learn how to do this sort of thing. But the exciting part of the future is what can happen when we put these sensors on people that measure all of our vital signs. And what kind of sensors am I talking about? Well, we already know today how to do an EKG, an EEG. We can measure oxygen saturation. We can measure skin temperature. We can measure the resistance of your skin and all kinds of other things. With all of that information, it's possible to do an enormous amount of diagnosis. So I want to skip ahead there, and first of all, to tell you what the problems are that keep us from using all of this information, and started to do that today. I mean, I'm talking about technology that exists now, not future technology. Well, first of all, we have to decide who owns this information about you. Who do you think owns the information about what your heart, skin, oxygen content, all of these things? Who owns that information? Anybody want to take a guess? At the moment, if you did it, have your doctor do that, he thinks he owns that information. If you go to the hospital, they think they own it. Well, we have a law in the United States now that says that the individual can have access to all the information. The way it should be is you own that information. You decide who can see it and who cannot see it. We have to learn how, first of all, to implement that. Not very easy, because I've been trying to get information from my own hospital, and our law requires them to put this information on in technical form, and what they sent me was a stack of paper about this thick, which is essentially useless to me. So there's a lot of work to be done on that. We have to make sure that this information is secure. One thing we don't want is to have our information in electronic form and accessible to other people. There are a couple of problems which you may not have in Italy, like having to do with the lawyers. Any lawyers here? I don't want to offend anybody. Oh, yeah. Please don't be offended when I say this. But one of the big problems we have in the States is liability. Doctors are actually afraid to take some actions because if things go wrong, they get sued. And yet, one of the things we've been learning at this conference is it's hard to be creative, hard to reach out if you fear failure. And so we have to solve that problem. All of these problems are going to get solved. So here's where I make my predictions. It's my belief that in the next 10 to 15 years, there will be the application of a computer that's very much like IBM's Watson. You know that Watson has already beaten the best chess player in the world, has beaten the best Jeopardy players in the world. But I'm talking about 10 or 15 years from now, a Watson that is 10 times more powerful than the existing one, and perhaps more so. I will then talk about sensors, very simplified ones. So you only have one or two sensors that measure all of the things that I talked about, plus a couple of additional ones. The first one that will appear that has enormous value is a glucose measurement. Today, I don't know if there's anybody that's diabetic here, but you have to take a blood sample You have to actually prick your finger, take a blood sample, put it on a piece of paper, and put it into some kind of a analyzer. And it's going to be very difficult to get over that. Not only technically, but think about it, those little slips of paper that go into the analysis are now a multi-billion-dollar industry, and it's going to be a little hard to get people to give that. But that's going to happen. The next thing that's going to happen after that, in 20 to 30 years, is there will be sensors available that will be able to sense a few cancer cells. So in 15 years, we're going to start accumulating information. We're going to have the order of millions of people transmitting their data into this big Watson, and Dr. Watson, is going to start analyzing all of this data. It's all going to have the health history of these people. It's going to integrate all of this information. 10 years beyond that, we're going to be up to 100 million people. Now, this computer is going to start figuring out, for a given set of information, for a given set of symptoms, these are the diseases that are starting to happen, not diseases that already have occurred. Remember, the thing that I asked everybody to remember was all diseases are actionably preventable. If you catch the disease early enough before it becomes a disease, you never even become aware of it. It's going to take 25 to 30 years before we accumulate enough of this data so that we can start telling people not some average number that is the normal. I don't know if you've ever looked at when they measure things on your body and they say, you're normal. And then you look at the range of what normal is, and it's so huge that it includes almost everything. It has nothing to do with you. We are going into an age of personalized, customized medicine where Dr. Watson is going to figure out exactly what's happening to you. It's going to anticipate your diseases before they happen, and disease will be essentially wiped out. 35 to 40 years. I'm not certain that all of us will be there. I know that the Marconi scholars will be there. And when they see this happening, they are going to remember that Marty told them all about it. So thank you very much.